Good morning. So today I'll be discussing how to give a directed cough therapy procedure. And you just simply use this for people who need their secretions mobilized and just so they can be able to cough and get all the mucus or secretion, just get it up and out of their systems. You won't, contraindications for this therapy will be patients who have just had abdominal surgery or surgery of any kind who can hurt and strain, or it can make their problem, whatever they're going through, 10 times worse. Like if they have a headache or if they're feeling nauseous or something along those lines. You just don't want to avoid this therapy. Um, First things first, you're just going to review the physician's orders. You're gonna look over the patient's chart. We walk to the room, verify the patient's name, date of birth, so you can make sure you're giving the right therapy to the right patient. You're going to wash your hands with some wash your hands, or you can apply hand sanitizer. Just continue to rub your hands together until it's completely dry. You're going to introduce yourself. Hello, my name is Mike Carey. I'm your respiratory therapist for today. Today I'll be performing a directed cough therapy on you. Make sure you're talking to your patients so they can realize, so they can know what's happening as well. Start off by just telling them, um, sit up in a upright position. If they can sit up, then they will sit up in a chair or sit up on the bed. If they can't sit up, they will lie on their side and have their knees bent, and the therapy will be able to be effective as well that way if they're not able to actually sit up in a chair. um, Equipment that you will need is tissues and like a container for whenever they cough, so the sputum can go into a container. And also, you're supposed to instruct the patient to um, you're then going to tell the patient exactly what they need to do and how they need to do it. And you're just going to tell them after they sit right in an upright position, they're going to take a deep breath. And once they take that deep breath, they're going to hold it and then cough. And you need to make sure you have your tissue and your waistband ready. And so once you see the sputum, you need to make notes of the volume, the consistency, the color, even odor, because sometimes there's a possibility that it will smell. So you need to make note of everything that you see, and also look out for like if any blood could possibly be in the sputum. Like everything matters, so you need to make note of it. And if a pillow or your hand, like holding it over certain areas that are probably be more painful if they cough, putting pressure on that area will possibly help as well. So you start off with inspiration,